Hello. Hello, gang. How are you guys? Good to see you all. Hope everyone's doing well. A lot of exciting times ahead. Got Christmas coming up, got the new year. We've got sweatshirts now. The sweatshirts. So you guys asked for sweatshirts, so we got you some sweatshirts. Natalia, whose birthday is it? Oh, well, how did you know? Tomorrow's my birthday. How'd you know that? I don't know how you knew that, but I guess it's public information somehow. Yep, tomorrow in 3 hours, I turn 36. I know you guys like to Google, how old is Dr. Linkov? 36 tomorrow, 3 hours. Hi, Hannah. Hi, American Girl. What's up, Eric? Kelly. Yes, James, welcome. Did you know, James, that today we also dropped our hoodies? So they're available in a few different colors. Liz, why don't you show your hoodie?
Have the light blue.
Light blue hoodie for Liz. And so what we did was, this was like the old design. So you can see that the signature was pretty high up there. And this, is kind of hidden when you brought the hood part down. So now we have it lower. We have it lower down. So even when the hoodie is hanging low, you can still see the signature. So, oh, thanks, guys, for the birthday wishes. I appreciate that. A few hours. So yeah, so here it is. That's the launch, and we're doing 10% to Alopecia Areata Foundation. Marco with the link right there in the chat, and it's also in the description. Thanks, guys, for the birthday wishes. I appreciate that. Fernando, thanks. Are you gonna get one? We're just testing this out. We don't really know what we're doing with merchandise, apparel, but I'm like, if you guys want, sweatshirts, that's cool, or hoodies. We came up with this design. So we wanted to just do feel beautiful, but apparently someone has like a trademark on that. It's another like apparel company. So we couldn't do that, or else they'd send us some like cease and desist letter. So we did not do that. And so we added the eye, and we used the logo from City, my practice name, City Facial Plastics, and put that there. So that was the thought process. And thanks, guys. Thanks, Lucas. And so yeah, we'll see where this goes. Kebab, thank you. Thank you so much. The temperature, Jane, is cold, 30s. So we'll see where this goes. But my concept for it, because I want to do something more than just this hoodie or hoodie with our logo on it. The concept is to do like a body positive line, maybe one day. Have a whole line of apparel or what have you that's all about body positivity. I don't want it to just promote plastic surgery. I just want it to promote body positivity. As you guys know, that's really the focus. No, I'm not single. This is my wife.
Sorry.
uh,
Not
so, sorry, not sorry, but thank you for the birthday wishes. Um, that's where I'm going with the clothing, if you will. So if you guys have any ideas along the way about how to make it, uh, I don't know, because we're just testing the waters with this, how to make it more interesting or more palatable to people. We're happy to take your feedback and transform it into even better products. So we'll see. But that's really the message behind my whole channel. Is you guys kind of like, if you read between the lines, yes, it's like a reflection of my practice, and yes, my practice is hair restoration and facial plastic surgery. However, as you guys know, I'm sure everyone here has a decent sense of who I am. Um, I'm not about just the vanity of things. I'm all about promoting people just doing what's right for them, whatever it takes to feel better about yourself. And that's not the answer. Is not always surgery, and sometimes the answer is some surgery. It can help at times, and so I'm there to help those folks. But at the end of the day, I just want people to feel good about themselves. So if we can do that also through apparel, I think that would be interesting. I don't know of any company out there now that has that sole focus, and that's the direction that I want to take this in, and we'll see where it goes. And they say, from people I've spoken to, like, if you can get a celebrity to wear your clothes, then I guess it takes off from there. I mean, maybe we won't have to do that, but we'll see. All right, let's see what you guys are writing. Maggie, the hoodie is awesome. What inspired you to become a plastic surgeon? I mean, my initial inspiration to go to medical school, be a doctor, was honestly just because I loved science, medicine, like learning about all the different things like biology and anatomy and all that. And loved being able to help people in that way that we help people in medicine. There are many other people who help others, but there's specific type of help that we do in medicine, and I was always attracted to that. And then I loved head and neck anatomy, so that brought me to ENT, head and neck surgery. And I've always been into art and creative thinking, creativity, and so that then brought me down the route of facial plastics. And then hair I picked up along the way in fellowship. I was never formally introduced to it until fellowship. Then I did additional training in that. And here I am. And then the crazy thing happened, losing my hair as a hair transplant surgeon. As you guys know, that was really just shocking, but also terribly coincidental and ironic. And it just kind of almost reinforced my interest in the field even more. So that's the short of it. Alice, thank you. Wow, there's a lot of comments now. 80 people in here. Let me see here. Sorry, I'm just like scrolling up and then I'm gonna scroll back down. Thanks, E. Mercer. Appreciate it. Thanks for the birthday wishes, guys. Something colorful. Oh, Marco, you didn't know it was my birthday? Come on. uh, any wrinkle products work? Yeah, Botox. Botox works. Isn't it counterproductive for your facial plastics business to promote body positivity clothing? That's a good question. No, I don't think it is because if so, patients in my practice know that I'm very quick to say no to surgeries, and so you could say that that's counterproductive to business. But the truth is, there are plenty of people who are good candidates out there, and there are plenty of people who don't need surgery. And so I'm just there to give them honest advice when they do a consultation, for example. Or I have existing patients; they had one procedure, and then they come back and they want additional things, and sometimes I say no to those things. So it's all about, in my opinion, doing the right thing for people, and yeah, it makes me like I think about, I don't know. Sometimes I think like psychiatrists, like they're there to help people who are in a tough place, right, with certain talk therapy and medications. But it's not like they hope that everyone is sick and has problems and concerns in their life. I mean, they're happy when people are doing well too, but that's not why people see them. So it's kind of like that in a way, I guess. All right, let's keep going here. Doing anything for your birthday? Well, we went to see the Nutcracker yesterday here in town in Manhattan. That was phenomenal. It was ballet. We went to dinner with my wife, my daughter, my in-laws, and that was really a great time as well. And so, yeah, we have, I think, Liz, what you got me a massage. I have a massage uh, and a dinner later this week. So, yeah, and I have like a short clinical week. I have
and you
until
got
Wednesday.
the slippers.
And
You your
I got
slippers.
slippers. Yeah, I got slippers. I got this one, Uggs, slippers. I love myself a good slipper. So that's cool. Do you think art influences your work? Yes. Yeah, in a way, I see the face nowadays and the scalp as like my canvas, in which I can, you know, basically do artistic things, but in the form of surgery. Let's turn the heater off. So yeah, today I did an interesting case at the Brooklyn VA. We had a guy with a basal cell carcinoma of this part of his nose, between the lower dorsum and the side wall of the nose. And so I did reconstruct the flap. The dermatologist took off the cancer. They left a hole for me to close, and then it's a rotational advancement flap called the Riger flap. And basically it goes like up here and then down this way. If you can Google Riger, R-I-E-G-E-R, Riger flap. So it goes all the way up here. And then you go under the skin and you bring all this across. under the muscle too. And then you rotate all that skin down so the hole here can close. And then everything gets sutured. And it looks like a bunch of incisions, but then ultimately things heal well. So that was what I did earlier today. It was a nice case at the VA for our wonderful vets. So, okay. Hey,
George. Someone, I think.
George. Sorry, I'm just trying to figure out how to navigate this. There's Thomas. Hit the button, chat. What? Hold on, Liz. Like,
Oh,
hold on, Liz. Stop clicking.
Okay. You missed the super chat though.
I don't know. Super chat. I mean, something is up here. Top chat. What is that? Promotional spam may not be visible. No, I don't know what that is. Oh, George. Happy birthday. Do you do video consultations? Oh, thank you, George. Yes, that's actually the way that we do all of our consultations to begin with is by video. We're scheduling out now, I think, into June. So give us a call, email us, and we'll work you in, and that will be great. So then okay, let me keep going here. Sorry, guys. A lot of tangents tonight. A lot going on. We got the hoodies. Hoodies dropped. There's a link in the description below and at the top of this chat. And I've just been talking. Would be great to offer a Q&A after watching a particular video. Oh, yeah, that's a good idea, Brenda. Thank you. Yeah, the next video is going to probably go live on Wednesday this week, and it's going to be myself and my friend, colleague, chiropractor, Dr. Lipnitsky, and we're doing a reaction video to another chiropractor who puts balloons inside the nose and just inflates them until he hears popping sounds, and it's called face cracking, and you'll see what my thoughts are on that. Okay, Stock Bro, thank you very much. Check it out. We have 3 different colors to choose from. Hopefully you like one of them. Cameron, pink one. Oh, that's great. That's great. Thank you for supporting. Okay. Sorry, guys, working on getting through these questions. Liz, if you see something, just tell me. Have you always wanted to live in New York? Yeah. New York is where my family is, where I grew up. Yeah, we knew we'd be coming back. First day of taking Finasteride. I'm nervous, Doc. I hope you're going to be okay. Jiu-jitsu. We'll see. Time will tell. Good luck. Balding as a teenager. It can happen. It's not common, but it can happen. How does septoplasty recovery compare to rhinoplasty recovery? Usually it's a little bit easier of a recovery because the manipulation is usually internal, but there is such a thing as an open septoplasty. So it's like the same approach as for a rhinoplasty if it's done open. So for septums that in the front, what we call caudally, are very deviated, you have to make an incision here and open the nose to really be able to reconstruct that whole septum. So sometimes I'm actually taking a big chunk of cartilage, removing it, making it straighter on the back table, and then reinserting it back into the nose. So that's, so septoplasties aren't all created equal, and some of them are tough to get right. They're easy to screw up and to leave people with the same problem that they came in with, but some of them can be very difficult to actually correct. Most difficult technical procedure you do at City Facial Plastics? Yeah, it varies person to person. I would say, facelift is fairly technical. There's a lot of different steps to it. So that's the one surgery in my hands, at least, that I find the most like physically grueling, to be honest with you. And some practices, the ones that have been doing facelifts for 30 years, they're more set up for it. They have lots of assistance for it. And I don't have that yet, right? I have a lot of help for my hair cases and some other surgeries. But when it comes to a facelift, we I think do a great job, but it's a lot of it falls on me, and it's technically just physically, it's just exhausting. Like at the end of the day, like I feel like my back hurts more, and my hands just you suture a lot, and there's nerves that you have to be careful of in the face. So there's there's like an anxiety aspect to it, and you want to do a good job, and it's a whole big thing. So especially when there's a lot of neck work. So like anything else, it's not hard to do, a very mediocre facelift. It's difficult to do a very good one, and one that's appropriate for the person. So Do you do video consultations? Yes.
Someone asked this a little further down, but I thought this was a good
Happy
question.
birthday. Thank you for the birthday wishes.
How does diabetes play into getting plastic surgery?
How does diabetes
That's a good
play into
question.
getting plastic surgery? Well, you want to make sure that the diabetes is under control. So we want to make sure that the hemoglobin A1C is of a normal or near normal level. And we also need to look at trends. So sometimes people just live at a slightly above normal level. So for patients like that, I'll often get a medical clearance just to make sure that they're okay. You don't want to operate on someone with blood sugars that are out of control because they're more likely to have a complication. They're more likely to have poor wound healing, and just have issues, infections. So you have to be careful with diabetic patients. Someone asked Marcus, I have a noticeable sagittal dip in considering cranioplasty. Can you offer any insights on implants or remolding? That's not a surgery that I particularly specialize in. So that can be done, but I'm not the right guy for that type of surgery. Sometimes fat transfer can be a nice alternative to getting implants. I would caution you on implants that are permanent because, again, risk of infection and things like that. So you have to be careful with that. But in terms of remolding, like the frontal bone, that is definitely something that people do and offer, especially or doctors who do a lot of facial feminization surgery are very comfortable with that kind of surgery. But that's not something I do much in my practice. But thanks for the question.
And then another one was, what's the best filler for under eye filler? My plastic surgeon said he doesn't do filler there.
Yeah, under eye filler can be a tricky area. If you're going to do it or get it done, Restylane L is a very standard one that's used, probably the most frequently used one. So if you're going to get it done, I would go with that. It's like the medium viscosity type of Restylane filler, and you don't want to go with like Juvederm because it's going to attract a lot more water and then leave you with like a puffy type of look. So Matty, thank you for joining. And what do you think about Dr. Wong's new topical finasteride? I'd have to look into that. I'm not sure what his latest concoction is. What's your salary? We don't usually discuss that. Come on, that's a little more private, Aaron. But appreciate the question. Not as high as you'd think, to be honest with you. There's lots of expenses, and I have a lot of debt, but we don't give out actual numbers. Let's see, the gaming theory. Do you support finasteride usage every 2 to 3 days? Yeah, I mean, it's been studied mainly daily, so that's the most common type of use, but some people want to spread it out a bit, and I think it still has efficacy for the most part that way. Great, Claire. Love from Sri Lanka. Thank you so much. Living meme. Appreciate that. Happy birthday. Super. As I said earlier in this talk, I'm 36.
I'm sorry. I think there's Thomas Harris came up. I don't know if this is a question. Botox help nasal lines?
Oh, Marco. One sec. Marco, would Marco write? Where's my? Oh, wow. There's like a lot of just trying to go out. 2 orders for hoodies. Thanks, Michael and Cameron. Yeah, good job, guys. That's awesome. They make for great gifts.
Sorry.
Okay, go ahead.
I think the question is, does Botox help nasal lines? And then there's a request for do a bald man facelift.
Yeah, there's this one guy who keeps asking for the bald man facelift video. Yeah, I mean, look, it's tough, right? Because you're trying usually to hide incisions around hair so that it doesn't show. It's gonna be quite obvious, that look, with a good facelift where there isn't as much tension on the actual incision lines, like it could still look very good. It's just you don't have anywhere to hide them, so you just have to be extra careful. So yeah, but someone keeps asking for that video. And Stock Bro says the description of the surgery you did today was, yeah. I really wish I could just show you guys. These surgeries are pretty awesome. The VA stuff I can't show anything, because there's a lot of regulations behind the federal hospitals. But in my practice, as you guys know, I'm planning on doing some live stream surgeries in the new year. I have all the elements of it except for the arm that the camera is going to attach to. That's being made in Germany and will probably arrive in the middle of February. So I think by March, because then I have to get extra support built into like the wall in our space to support like the light and the camera and the monitor and the recording device. So hopefully in March we'll have all that set up, and then we'll start doing some live stream surgery, like most likely some hair transplant stuff and some lip lifts and other things I do under local anesthesia. It won't be the general anesthesia cases to begin with, but we'll see where it goes. But I think that's going to be super interesting. There's nothing more transparent than going live with the surgery, right? And yeah, there are a lot of potential issues with that, but I think there's more good that can come out of it than bad. And with the right patient, of course, it's not like suddenly during a surgery and be like, oh, now we're alive. It's going to be thought out, and patients are going to have. There's going to be some, of course, incentive for a patient to want to do that. But we're fine tuning all the logistics, and there's actually, believe it or not, some medical legal things, not so much with like, oh, what if something goes wrong during surgery. There's that element too, but there are things around incentivizing patients to do that type of surgery, and you got to be really careful with how that is done. So we're navigating that with our attorneys to make it sure that everyone is covered and everything is being done by the books and all of that. So, but that will be really cool, I think. Do you watch the hair loss show on YouTube? I've seen a few of their videos. I don't watch them religiously. I've been in touch with those guys, offered to do a collaboration. They seemed interested, but then I don't know, they didn't like follow through on it. So whatever. We've got one. We got a few collaborations coming up, but there's one we're planning with Gavin Chan from Australia, the Victorian Institute. Really nice guy. Luxaria, that's the next one we're filming. She's got a really cool channel. Jackie, Nerdy Crafter. Hopefully she comes to visit us in February. We'll see. So yeah, a few others.
Oh yeah, and sorry, going back to the.
Oh, and then Austin Chang, who's my friend and my med school colleague. We went to med school together. He's now a big GI doctor at Jefferson. You guys probably have seen him on TikTok. He has a YouTube channel, Austin Chang GI, and he now became like the chief medical officer for Medtronic in the GI department, and he's doing great things and really interesting, great social media presence. And he's the head of social media, like the chief of social media for Jefferson Hospital in Philadelphia. So we're going to do a sit down and talk about what med school is like for us and reminisce a little bit. And, it's been a while since med school, so that will be a lot of fun. Sorry, what was that, Liz?
I was going to say, you never answered the question on can you do Botox to help with nasal lines?
Botox for nasal lines?
Yeah.
Nasal lines like these lines, or are you guys talking about like bunny lines up top? So like for like up here, if someone does this and they have a lot of bunny lines, you can do a little Botox there. It can help, like right here. These type of lines, some people call them, they're nasolabial folds. Some people call them nasal lines, but nasolabial folds is the official name. And that you would usually use filler, not Botox. Good. What do you think about 0.25 milligrams finasteride every other day? I mean, I would just say do 1 milligram daily. There isn't the evidence that shows that using that lower dose is going to help prevent side effects, and you might lower the efficacy. So I wouldn't do that. Oh, can you do a video on how you got through med school? Yeah, I guess I could. That one day we'll release that. All right. So I'm like really behind on these, aren't I? Sorry.
I'm just trying to point out some of the.
I'm trying to scroll through.
How many? I don't know.
Plastic surgery on a toenail. Oh, geez, not from me. Maybe from someone else. Not sure.
Okay.
Happy holidays, Byzantine.
So how many? I don't really understand this question, but how many grafts does the average person have available? 6 to 8K. Is that?
Is this someone asking a question?
Yeah, it's a question. I don't
Yeah,
really understand.
yeah, 6 to 8K. Well, yeah, I mean, graphs, it depends if it's FUE or FUT. If we're doing FUT, the overall yield per case and overall just over a lifespan is going to be higher. 8 is kind of high. I mean, that's too high. At 8K, you're going to exhaust a lot of the supply, and the back's going to look real thin. So figure about. Usually, it depends on the individual. Some people have big heads, some people have small heads. But FUE, you're looking at maybe 5,000 to 5,500, and FUT, maybe add on another 20% to that. Okay, all right, so good. And then let's keep going here. Thank you, Mike Rogers. Have you heard about Elocore microcoring? I have heard about that. Someone recently told me about that. I don't remember who it was. I added it to my list of videos to eventually do, and that is something interesting to me. It's interesting because when we do FUE, we don't go down to the size of a microcore, which I believe they're doing like 0.5 millimeter little microcores that are being removed for that type of treatment. When we're doing FUE, the smallest we'll go generally is 0.8 or 0.85, but in my practice now, we're choosing to go to like 0.9 and 0.95 for our FUE extractions. But like a 0.8, 0.85 still leaves a little scar. So my concern with microcoring 0.5, I feel like it might still leave little scars. So I'm not totally on board with that type of treatment. I'd love to see their true before and afters and see what the degree of scarring is before recommending anything like that. Medication to prevent blood clotting for surgery. We don't give anything for like routine elective surgery. Austin Shang selling his soul. I don't know if you call it selling his soul or just being, entrepreneurial, and he's a great doctor. So I'm not sure. I guess that's one way to look at it, but I don't really see it that way. Let's see here. Botox. Okay, so happy birthday. Thank you, Mike. Thank you. 24-year-old guy with alopecia areata. Hi, Don. Is it difficult for you to navigate professional spaces when people think you may look ill? Uh, yeah, I don't really care. You just have to stay confident and not care too much about what others are thinking about you. But I don't think people react to me in any bad ways per se. So I don't know. Hasn't really bothered me. Uh, More recently, I mean, in the beginning, it's an adjustment, of course. All right. Nice way to hear a doctor talk casually about all this stuff. The surgeons are not so friendly. Cool. Thank you, Stock Bro. Thomas Harris, hit the like button, guys. Yes, do that. Thanks, Gustavo. Uh, it might not actually be the worst idea to share ballpark income, because in your comments, people are constantly thinking you're a multimillionaire just because you're a doctor. Yeah, well, they can think all they want to think. I mean that. Yeah, it's not something we're doing today. Wishing you and your family a happy holiday. Thank you. Easy way to order hoodies. Brenda, there's a link. There's several links in this chat, but also in the description below. And maybe Marco can add the link back in. But we'll also, we'll pin it to this video when it goes up. So there'll be an easy way to find that link. Rosemary oil, weak evidence for the efficacy of rosemary oil. There's one study, and if you look at the statistics, they're not that strong. How did my wife and I meet? We met in New York City through a family friend of mine and her college roommate. I do blepharoplasty. Lower blepharoplasties, sometimes I shy away from and send them to colleagues because they do more than me. And I get a lot of younger patients asking for lower blephs, and it's very nuanced. I just tend to send some of those away, but upper blephs I'll do in the right patients. Do you guys ship the hoodies internationally? I don't know.
Marco said yes.
Marco said yes. Shipments are handled by Printful. Yeah, we don't, we were just using like shops like Shopify, Printful, because we don't know what the demand will be at. So yeah, those services I think ship wherever. Are the hair follicles dead? Leon's asking. No, they're not dead. Yeah, they would come back. The hair would come back. Actually, yeah, if I was on immunosuppressant drugs, I just choose not to take them. And plus, my insurance keeps denying the drugs, the immunosuppressive drugs. So I don't really have a choice unless I want to pay out of pocket, which I could do, but they're not cheap. So it's fine. I've learned to move past the hair, and it's okay. Who's your favorite and best hair transplant surgeon around the world? It's a good question. I don't know a lot of them personally. Maybe over time, there are these international meetings, but with COVID, they've been mostly virtual. So it's been hard, I guess, to connect with a lot of folks. And I'm seeing good results come out of many different clinics, and that's like promising, I think, for our future. Uh, yeah, I was trained by Jeff Epstein in Miami. I think he does very good work, but there are many others who are also excellent. Bob True in New York City is phenomenal. One of my hair techs comes from his office, and he's, I guess, nearing retirement, but he's very good. Yeah, there's some people around the world that really shine and do good work. All right, who else? All right. Okay. Hola, Gigi. How many grafts? We did that one. Scarring alopecia, you can sometimes do a hair transplant. You don't want it to be in its active form, but if it's in a stable form, you sometimes can. All right. Are men with fine blonde hair good candidates for hair transplants? Sometimes. Again, just depends on what their goals are and what their donor sites look like. Zygoma reduction. For cosmetic reasons, I do not do that. You'd have to go to someone who does a lot of that type of surgery. I think in South Korea, they do a lot of it. Um, Thank you, Fly. I appreciate that, even though, you don't like the rest of us, but thank you. Kelly, one drooping brow, but my surgeon retired. Yeah, I mean, definitely you can find someone, I'm sure, who could help you. No one knows, Prab, when the cure for baldness will be here. We just don't know. What, Lizzie?
There was another question that came in that I thought was interesting. Like, what's the deal with like so many people getting eyebrow transplant? Is it because women overwax?
Yeah, I see that. What's the ideal eyebrow shape? Yeah, so we have videos on that, like ideal shape and aesthetics, but yeah, overwaxing or overplucking is one of the most common causes. So people used to do that quite a bit, now a little bit less so. So that's the reason why it's become more popular. I mean, it really does change the face quite a bit. Thomas, thank you. Thank you. Austin, yeah, we talked about that. Dr. Linkov. Philtrum measures 20 millimeters. My good candidate for lip that wasn't normal. So, yeah, so it's not just about the length of your philtrum. There are other elements, right? As I talk about in my videos, Lady P, you got to look at the dental show, upper teeth, how much show there is. You have to assess the fullness of the upper lip. So there's lots of elements. It's overall facial proportions. Don't forget to like the live stream, guys. Yes, Marco is right. Please like the live stream. Opinions on Zygoma.
You want me to pick out another one?
Thank you, Shalom. Yeah, go ahead.
What are some of your professional goals for the upcoming year?
Professional goals? Well, setting up that camera system so we can properly live stream surgery and just do better videos, I think would be one of the big ones for the new year, and just to continue to do good clinical work. I mean, I do not like that many different types of surgeries, so the ones that I do, I like to really perfect and get as right as I can. And there's no such thing as a perfect outcome, but as far as like from a technical perspective, I'm constantly thinking of ways of making my steps better and better. I can't always predict exactly how someone's going to look, but whatever I can do on my end, I'm continually working to make better. And there are a few people that I'd like to visit this year if possible. My schedule's pretty busy, but if I can get out there and see a few folks, some colleagues of mine that I respect for facial plastics in particular, I'd love to do that. and eventually also for hair. But I can't be traveling every other week, just have too much clinical work at home. So that would be another goal, to really visit people's operating rooms and see how they're doing some things and take some of that back home. I think there's always something we can learn from each other. So that would be important to do. Okay, let's see here. Can I do Metamorphosis? Can I do PRP without finasteride? Yeah, those are two separate medical therapies. Finasteride is probably going to be a better type of long-term strategy. PRP, though, is something that can give you a boost as well. We usually, for PRP, will start with monthly treatments times 3. I use the M-Site system, 60 cc dual spin kit. And we do that then after the first 3 sessions. We do it every 3 to 4 months. And we do a ring block for numbing to keep people comfortable, unless we're doing the needleless method, which is with the jet peel system. And my article on that was recently accepted into dermatologic surgery, and hopefully will get published in the next few months by them. But it's been accepted, and they sent me the proofs. I already edited the proofs and sent it back to them. So that will be really cool. I'll make a video about that. I'm not allowed to make a video about it before it gets published, but once it's published, I will surely make a video on needleless PRP. You guys maybe caught me on the Dr. Oz show talking about that like 2 years ago, but I actually did a research study. So that study is about to be published, which is exciting. Have you heard of Jeffrey Schreiber in Maryland? I have not. Is there any way to distinguish between telogen effluvium and androgenic alopecia? Yes, there are some pathologic, like if you were to take a sample and look under the microscope, there are some differences between the two, and then there's just some kind of clinical differences between the two. In telogen, you're looking for like a more global thinning. In androgenic alopecia, there are certain patterns that we look for, different in men and women. Thank you, Rose. Happy birthday. Thank you.
Question coming in. How soon can you have lip filler removed if you're having an itchy reaction? If you're having, or some, yeah.
Well, if you're having it depends when you start to have the itchy reaction. If you had the itchy reaction right away, that could be a sign of an allergic reaction to the filler material, or to the lidocaine, because there's usually lidocaine in, so it's sometimes hard to distinguish. Is it to the actual HA filler, or is it the lidocaine that's in the filler? But yeah, I mean, I would just get that dissolved ASAP. That would be my recommendation.
And then there's
Anti-Derek, thank you.
You mind if I give you 2 more?
2 more questions, yeah.
Okay. Do you do Botox?
We're here till 10, so we're not,
I know, but there's a lot of questions.
No, it's good. I'm just saying.
I know.
I'm in no rush. You guys in a rush?
Okay.
I'm not in a rush.
There's a lot of questions though. Okay. So do you do Botox for teeth grinding?
Yeah, sometimes. So less and less people are coming to me for injectables because the weight is so ridiculous. So I'm actually looking to maybe bring on like a nurse injector who I can, help like educate on all the proper techniques, and then they can do the injectables because I'm more focused on surgery these days. But yeah, people still come to me for masseter Botox, and the trick there. And I did an article with was it BuzzFeed? BuzzFeed. If you Google BuzzFeed, can we put in a link here? I don't want to get off this list thing, but maybe you can put it in. Yeah, if you go to BuzzFeed, Marco, or maybe Marco can find BuzzFeed, put in masseter Botox and then my name, you'll see the article. And if you inject too far medial, like not far enough back or lateral or posterior, and if you're too far forward, you can affect the risorius muscle, and so the smile can be impacted. So you have to be careful with that injection, and the injection has to be far enough back to not impact the risorius. So just the nuance there.
And then, sorry, one more I wanted to make sure you...
Do you recommend drinking topical minoxidil? I mean, as your username says, no. I wouldn't do that. That's not a good idea. All right. Let's see. Which treatment is more effective, efficient? Minoxidil, finasteride, microneedling, or laser? Finasteride is going to give you the best results. So I would recommend that. And if you wanted to add something else, usually minoxidil is the next best thing. Though there is good data to suggest that microneedling and laser therapy can help.
Hold up, and then sorry, not to cut you off. Do you think detuminescence? I don't know. therapy, scalp massages are helpful.
What kind of therapy?
Detuminescence. Scalp massages are helpful for growing back hair or preventing hair loss.
No. I don't think so. I think that, I mean, it feels nice. I love I love me a nice scalp massage, but there's no evidence at all to suggest that that could help. Michael Kranz, thank you very much. And so who thinks that Liz right here should have her own YouTube channel? Marco and I have been pushing her to start her own. She's a phenomenal educator. And as you guys know, she's an internal medicine doctor. And she, I think, would be fantastic. So we're trying to motivate her. She's a little nervous to start, but I think once she gets going, she has a lot of value to bring to the community. And I don't know. Let me know, you guys. Let us know what you guys think. If Liz should start her own medical YouTube channel.
I'll think about
Blessed
it.
and Bright,
I'll
thanks
I'll
from
make it into a
Arizona.
New Year.
Denise, thank you. Did you get a sweatshirt, Denise? Come on. You're like one of our regulars here.
Oh, and
Metamorphosis, do you do all the procedures yourself? So there's always some degree of assistance. I mean, it's not like I'm the only one in the room for surgery. There's always someone assisting me. For hair transplants, some parts are done by me, some parts are done by the technicians. For other surgeries, it's usually mostly me because there's less room for error, I would say. But hair transplant, the techs have to be phenomenal to make the results good and consistent. So the better hair transplant surgeon you are, the better you'll pick your technicians. So that's really important. 8 more likes, guys. So yeah, please like this live stream. It really does help us out. What about genetic female pattern baldness? Any hope? Yeah. Very similar treatments. Oh, excuse me. Thank you, guys. So yeah, definitely very similar methods and hair loss treatment solutions are available for women. Not all are the same, but we highlight the differences in our videos. And transplant is also often an option for women as well. Um, Liz, internal medicine. Oh, so Liz, you're like an editor in here?
yeah, Marco.
Wow.
I don't know if I can handle that.
Liz is like an editor or a moderator. Uh, can minoxidil cause miniaturization? Doesn't usually cause miniaturization. No, there's an early shedding period for like the first 3 to 6 weeks, and then that goes away. So yeah, haven't recovered for 2 years. That's very uncommon. If that's happened to you, Marius, I'm sorry to hear that, but that's very, very uncommon. Do you think getting a lip lift after a rhinoplasty can compromise the results of the rhinoplasty? It's not necessarily going to make the tip droop, but what can happen is that the nostrils, like because the nasal sill can get pulled down with a lip lift. So if you've been like very worried about the nostrils changing and then you go to get a lip lift, expect there to be at least some degree of drop, and that could make the nostrils look different. But with good technique, you shouldn't make the whole tip droop. That would be very, very unlikely. The hoodies look great. Thanks, Maggie Fry. Make sure to pick one up. Oh, I'm trying to like get through this, and here we go. Liz, it's hard to tell how far back I am with these comments because there's so many.
No.
You guys are just overwhelming us with comments. So someone here, scheduled for rhino, ultra pulse CO2 laser, acne scars, and chin lipo all at the same time. What do you think about laser on the nose right after a closed rhino? I think it's okay. I think as long as the power setting is not too high, you should be okay. Will this help neck skin for sure? Think it will help neck skin for sure after a lipo. No, nothing's for sure. I'll tell you that much. And I hope that they're not doing lasering on the neck. You have to be very careful with that. It doesn't regenerate skin the same way as the face does. So you have to be careful with CO2 on the neck. Chin lipo, for the right candidate, can be a nice addition.
Oh, and then another question comes in. I don't think you answered this one. Any evidence of black castor oil working for hair growth?
Not that I know of, but I'd have to do a deep dive. We have a video that's on our list to do about like different like nutraceuticals and like natural remedies for hair restoration. It's just that there's like a lot of voodoo out there. Like it's a lot of it is unsubstantiated, unstudied. So I'm gonna do a deep dive at some point. For my like non-surgical hair restoration series, and we'll try to see what actually has some evidence behind it. There's not that much, to be honest with you. Like I said, rosemary oil has one study, and the statistics aren't even good, and yet people constantly cite that as like it being equivalent to minoxidil because of that one poorly done study. And that's like that's considered a good thing for hair. What about everything else that's been untested? So we'll do that deep dive. I haven't gotten around to that yet. My next video for non-surgical hair will likely be PRP, but I haven't even drafted that video out yet. And so yeah, so the video dropping on Wednesday, most likely this Wednesday, will be more about a reaction video. I think it's really interesting because there's this idea of neurocranial repositioning that certain chiropractors do, where they essentially put in an inflatable type of object, like a little balloon in the nose, and they inflate it to kind of create the sound of a crack that they think equates to the cracking that you hear, in like your hand or your finger or your back. And there's some people who just they live for that sound, and yet what they're cracking in the nose is very different from the sound that you hear in a joint. So it's going to be myself and a chiropractor um, sitting down and essentially giving our thoughts about what's going on in that video. So that should be a good one, and that's coming out next. There's been a lot of fear mongering around finasteride. My libido has gone up since I started. Nice, Chad. That's the spirit. Yeah, I agree with you. And I tried to give a balanced perspective in my finasteride video on YouTube. Check that out if you guys haven't watched it yet. But, I didn't want to discredit all those people that say they have, permanent side effects from it. But it's such a small number of reported cases in the actual literature that I think some people have amplified it on the web through different forums. So I would agree with you on that. All right, let's keep going. Marco posted the BuzzFeed article for the TMJ stuff, so check that out. Rogaine for eyebrows could help. Yes.
I saw an interesting. Where'd it go? I saw an interesting question.
How long after hair transplant can you wear a hat?
Okay.
Well, honestly, the same day. Some people walk out of our office in a hat, and but you just don't want it to be tight. It's got to be loose. And returning to work, I tell people about a week off from work.
Where was the question? About
Brown
the
spots.
testing?
Well, for brown spots, depends what kind of brown spot it is. But there's like IPL, there's broadband light therapy or intense pulse light therapy, which can help different chemical peels. But I don't really do that in my practice. I usually send that to a dermatologist.
Can I give you one?
Yeah.
Trans person here with patchy beard growth. Any thoughts on minoxidil on the face?
Yeah, minoxidil on the face can help. There's a whole Reddit community around, that whole thing, minoxidil for beard restoration with microneedling. Yeah, it surely has been shown to help. So yeah, that's something to look into. I would check out that group. Forgot what they're called, but if you put that in Reddit, beard minoxidil, you're going to find them. All right, so random question. Antimicrobial phone cases, are they a real thing or a bunch of brouhaha? What do you think, Liz? Antimicrobial phone cases, is that a thing?
Oh,
Do
honestly,
you think they work?
I don't know. I honestly I'd have to do like more research.
Yeah, we'd
My
have to
gut tells
research if
them-
there's any data
I
on
mean,
that.
it just depends. My gut tells me that it would be less effective than washing your hands and
Better to
using-
just wash your hands.
Yeah, that would be what
Okay.
my gut would tell me, but I'd have to really.
You heard it from the pro.
Yeah, I don't know though.
I'm going to stay in my lane on that one. Can someone with androgenic alopecia regrow hair with finasteride and minoxidil and use microneedling to maintain their gains after stopping minoxidil and finasteride? Theoretically, yes, but it's going to be different per individual. But of course, the combination is going to be much more effective. Mike, thanks for the question. All right, let's see what else. What can be done for thin under eye skin? Anything other than fat or fillers? Uh, it's a tough area. If it's like crepey skin, you can do laser to tighten it up. That's actually a nice thing to do and is very safe. Um, but otherwise, if it's just like a hollowing, I mean, there are like actual cheek implants that can sometimes be placed. There aren't any great options, but the lower blepharoplasty, I would say, is still the gold standard. And you can do what's called a repositioning of the fat, so lower bleph with fat transposition over the lid cheek junction, and that can be a nice procedure. I'm not doing that too often these days. I send that out usually to my ocular plastics colleagues because I'm pretty busy with other stuff. Yeah, Shalom says Liz should have her own channel. You guys would support her, right? Like, it would be so nice. Like, she's so much prettier than me. It would be great. Okay. Okay, so what else? She would be great. Thanks, Elena. Thank you. Yay, Jane. Yes, thumbs up. Marcel, thank you. Lounge, would you use finasteride if you were a candidate? Yes, I would try it and I would see. If there were no side effects, I would keep doing it. It really is a good medication for hair restoration and overall quite safe. If you are taking blood thinners, do you recommend getting a hair transplant? It depends. It depends what kind of blood thinner, what's the reason that you're on it. Because if you're on a blood thinner for like a heart condition, the epinephrine that we use during a hair transplant might not be safe for you. And if you're on like a serious blood thinner like Coumadin, or some of the others, and um, or Eliquis, and you can't come off of it because of your heart condition or your whatever condition, no, then we would not do a hair. You wouldn't do an elective surgery and risk having a lot of blood loss with it, and also potentially a poor result. So you'd have to be able you'd have to be able to come off of it, and it would have to be safe to come off of it. So yeah, it's a nuanced question. What else? What else? Random question. We did that one. Don't be nervous, Liz. Thanks, Denise. Oh, Mike says, what would your niche be?
Oh my gosh, I don't
We
know.
haven't thought through that because we're just
Hey,
trying to
we're
get her
not.
to like
Yeah,
start the channel. We
I
don't know.
There's too many topics in internal medicine. I have
Yeah.
to narrow it down and
Well, yeah,
maybe
but the
like
nice thing is she could go between different topics, right, Liz?
somehow like bridge my interest between internal medicine and reality TV somehow.
Oh, she likes reality TV. She really does. So yeah, maybe highlighting like Real Housewives, like it when they mention some medical thing. They always mention plastic surgery. They never mention like
there's a lot of plastic
actual
surgery on there.
medical
You
problems.
might need to touch on that. That might actually be a nice idea for
Yeah, that would be a good video. Yeah. I got my cast off today for rhinoplasty to remove a dorsal hump. It looks like the hump is still there. Yes, that is normal. I hate that because I hate seeing that. You remove the cast at a week, and so sometimes on like online you're seeing like these reveals and everything. They're crying and oh, this looks so great, but they don't show you the ones where they take the cast off and there's still a hump. That is often swelling that will get better. So. Frigate bird, if I'm pronouncing that right, I wouldn't be nervous. Billy says, do some collaborations with Liz. She's a fabulous spokesperson. Thank you, guys. Okay, dandruff. Can dandruff be an obstacle for hair transplants? Well, it has to be pretty out of control to be a hindrance for a hair transplant. If there's some dandruff, some eczema, it's usually fine. If it's like way out of whack and a huge problem all across the scalp, then of course, you don't want to be doing a transplant in that situation, and you want to get it optimized first before proceeding with surgery. Luna says, I hope she'll start her own channel. She would love to watch your videos. How much can skin be thinned during a closed rhinoplasty? it's limited, and you want to be really careful thinning skin because you can cause vascular compromise. I like the hoodies, Mary. Thank you. I feel beautiful is very positive. I'll order some. Please tell your wife to start a YouTube channel. I'd love to hear and learn from her too. That's awesome. Spironolactone, Denise, for women for hair loss can be very effective. You just have to monitor the potassium levels because it can mess with the electrolytes. My grandpa did the same thing. Bless you. Let's see. Oh, Marco, that's when I sneezed. Well, that was a while ago. I'm really behind here.
Yeah.
What's
There's
your
they saw one just come in about what
Oh, I definitely sneezed into my shirt. I think that's the right way to sneeze.
there was one
All right, I'm
about
trying to skip ahead here a little bit.
more personal. I can't find it now, but it was a question about like what advice would you give someone who I think wants to maybe go back to medical school at an older
To go
age?
back to medical school?
Yeah, I
Don't do it.
can't find the actual question.
My advice is don't do it. If
I-
there's oh yeah, what advice would you give to Samumu who's of an older age and is considering med school?
Right. Okay. I was told you.
Listen,
I couldn't
it's
find the
tough.
exact
It's a
question.
huge commitment. If there's anything else you can do with your life, do it. It's not an easy road. We Liz and I have pretty good spirits about it, but I don't
Oh,
know.
it's really hard.
It's really hard. Yeah. Yeah, it's tough. It's nice to be on the other side of it, but going through it is kind of hell. So, and it's hard for everyone in different ways. It's not like everyone experiences it the same way, but there's no one I know who didn't have some difficult time, at least, in some part of the medical school or of their
it's not
training
just the school, right?
or
It's
of their
the school.
residency.
It's like it's residency and fellowship and that aspect of it is
Yeah,
really
it's the
hard. In another
training.
way, yeah.
The training
so-
is involved, and it's really hard. Yeah, because you might like ace med school, and then you go to residency, and you have patients dying on you. You've got like your superior screaming at you. You don't know what you're doing, and you really don't. And so there's a lot to learn. You could ace the test, but then real life is a lot more challenging and complicated. So yeah, and so it's hard, and then you get out and you're in practice, whether you're on your own or you're doing some sort of group practice or hospital work, and then you have to deal with a lot of bureaucracy, a lot of politics, practice management headaches. So like I always say, like the surgeries for me, that's like the easy part in a way. I mean, obviously they're not easy, and but in some ways that it's easier than a lot of the other things the headaches that I have to deal with. So when I'm actually operating, like it's good. Like I'm in a good place. It's everything else that can be hard.
And sorry, one more. I just want to make sure you saw this one because I know you're just gonna have to like scroll and answer random questions. But any effects of finasteride while on TRT? I think that's testosterone replacement there.
Yeah, I mean, it's the same side effects would still hold on testosterone therapy. Cool. Michael Krantz, what do you see your 5-year goal for your channel practice? I mean, I'm thinking on the 2-year plan. Right now it's 5 years. It's really hard to predict. I didn't even know this YouTube thing was going to happen and take off, to be honest with you. So that's brought a lot of interesting projects, and has kind of made me think about different other avenues and ways to grow the practice, but also do things beyond the practice. And that's something that I wasn't even thinking about a year ago. So there's a lot we want to do with education. I mean, the videos that I make obviously are for educating just the masses. I also want to educate other doctors looking to learn the specifics of the type of surgeries that I do. And I continue to do that at meetings and lectures, and I give lectures to residents, and I go to conferences and give talks, and there's all this kind of stuff on the back end. But then we also want to educate people on how to do things properly on YouTube in the healthcare space in particular. So that's another goal. And then with this the sweatshirt thing, you guys asked for sweatshirts or hoodies, so here they are, by the way. So make sure to get one. And the link is in the description, and we've put it in the chat. So pick up the sweatshirt. But like I said earlier in in this chat, we want to do like a body positive line of just apparel of different kind, different things. So if you guys have ideas, let us know. But I think we're going to start to get creative. And how can we, through clothing, allow people to express themselves in a way that shows their confidence, that makes them feel better, that they can announce to the world that I feel good about myself, whether I had a plastic surgery or I don't like plastic surgery and I love the way I am without anything, whatever it might be. We're all for it. So these are, again, other ideas I have, and so we'll see. So 5-year goal, I don't know, is to keep building all those things up, keep growing my team. Eventually, I'll probably have to, take on a junior associate. Maybe within 5 years, I'll have someone on board to help me. So we'll see.
Okay, you have 5 more minutes, and
Liz is cutting me off in 5 minutes.
There's
Sugar, love the collab with Lori Hill. Thank you so much. Lori is great.
I want to just pop in because there's at least 2 people that asked the same questions.
Okay,
so
okay.
There might be a lot of interest in this.
Yes.
What can be done about itchiness with minoxidil?
Well, the itchiness is usually a contact dermatitis, and as I talk about in my video on minoxidil, usually it's the polyethylene glycol, or the PEG, which incidentally enough is also what's found in the vaccines, in like the COVID vaccine, that some people were getting reactions to, and the thought was that it was the polyethylene glycol component of the solution, or in the solution in the vaccine, and also to the solution in minoxidil when it's sold as a solution, that gets people sort of triggered, whatever their skin reacts. So the way to deal with that is to switch from the solution to the foam, and in most people that sensitivity will go away. So that's a very important point. What else? I love reality TV. Would you inject filler on only one portion of the lip for asymmetrical lips? Yeah, sometimes. Yeah, Lexi, that can be done. What else? Let me scroll down here. Yeah, Hassan, don't spam. Don't spam.
This question was about hair falling out.
If you had a hair, so people reach out to us and they had like surgery yesterday somewhere else, or they had surgery a month ago. My recommendation is always like, talk to your surgeon. Like, you picked your surgeon, right? You trusted your surgeon to do, or the clinic, right? But hopefully it was the specific surgeon. So you should trust them in the recovery period. So that's usually our response to people. I mean, unless someone's having a bad complication and they can't, for some reason go back to their surgeon, we'll try to help them out. But you have to first and foremost, talk to the person who did your surgery. I mean, in the 1 month out is a very early time point, especially for hair transplant. If you're having issues, a year out, and you've already seen your doctor and there's not much they can offer you, then I would reach out to others. But always trust your surgeon who did your surgery, or else why would you pick them in the first place, right? So to deal with a lot of the post-operative things, because they're the ones that did the surgery, so they know what they did and they will likely know how to help you. What else? What is your opinion about Accutane? No. So if you're on Accutane, like the pill Accutane, right? The pill is Accutane is the oral, right? Because there's retinoic acid, but Accutane is the actual pill. So if you're on that, it really can affect wound healing. So you don't want to have any surgery. You have to be off of Accutane for at least 6 months before having any elective surgery. That's how most surgeons who are doing this stuff properly will handle the situation. That goes for hair transplants. It goes for any facial plastics work. So you got to be very careful with Accutane. Definitely not while you're on Accutane, but even when you're off Accutane, you got to wait at least 6 months. Some people wait a year before doing anything because you don't want to have bad healing because you jumped in too soon.
Oh, and then, sorry, there's another question I just want to point out, because I know this comes up, I think, in your consultations
What's that?
say sometimes.
All right, we'll take 2 more questions.
With the lip lift and nostrils, does it cause your nostrils to show more than before? Is there a way to limit or prevent this?
Yeah, so I would say in about a quarter to a third of patients with a lip lift, there's some downward pull on the nasal sills. If your nasal sill is not robust and it just doesn't have a lot of substance to it, then it's more likely to drop a little bit. And there's very little that can be done surgically to prevent that. So it's just something you have to accept as a potential consequence of having a lip lift. Well, it is officially. Oh, Marco's asking where are you from? Oh, where are you from, guys? Yeah, come on, let us know.
Take two more questions.
Two more questions. We're having so much fun here. Okay, will fillers get rid of parentheses around the nose? Depends how they're placed, and if you're talking about this type of parentheses, like here, it's not my favorite place to place filler, to put filler, because it can be a little bit dangerous in terms of vascular occlusion. What are you laughing at? The models.
We'll take two more questions.
Oh yeah, that's how we roll around here. 10-10, 10-10. We're gonna stop. 10. The models for your hoodie are beautiful, including you, Doc. Oh, thanks. Yeah, Marco put me next to those other models, and I'm like, I feel bad for them. I'm gonna make them look bad.
Wait, are you talking about me?
No, the models. No, like on the Shopify link.
Oh.
Yeah, there's like these other guys, and then there's me, and I'm like, I feel bad for them. They didn't ask to be put up next to this hunk. Singapore. Oh, hi. California desert. Cool. Okay, New York, but not the city. New York, but not the city. Got it. Texas, Maryland. Hello, Boston. Jennifer from Boston. Queen Car. Like in the cheeks. Okay. Hi, Dawn from Texas. We got Sugar from Canada, Vancouver. Cool. Nice, Denise. I knew you would do it. Thank you. Thank you so much.
Microinjections question.
What? Which one?
Do microinjections with dutasteride work to stop receding hairlines in your 20s?
One more time?
Microinjections with
Of what?
dutasteride.
Oh, I don't do that. Injections of dutasteride. I don't know. There's not great data for that yet. So I don't offer that. There are topical finasteride dutasteride combinations. They're still being studied.
And then I think.
Thanks, Kevin.
We'll round it out with this one because I think this is an interesting question. And
Thanks, Jalen.
What would change the face more? Fixing the nose, the teeth, or the jawline? Which one would have the most, I guess, dramatic effect on
fixing the nose?
Nose, the teeth, or the jawline?
Really depends on the person. Like if your teeth are super wacky, I mean, that could make a huge difference for somebody and their smile, without a doubt. The nose for sure can do a lot. Jawline, I would say, is probably the least. It's not so much the jawline as it is the positioning of the lower to the upper jaw. So orthognathic surgery can make a huge difference for someone's appearance, but all those can really make a huge difference individually and then collectively.
I think that's it.
Okay, Staten Island in the house. The nose is in the middle. It sure is. It sure is in the middle. Guys, this has been fun as always. Thank you so much. Make sure to check out these wonderful hoodies. Check out the hoodies. And so what we did, remember, we moved the signature down so it's more visible. Moved it down. 10% goes to the Alopecia Areata Foundation. Support their cause. And yeah, I think a lot of great things in store. If you guys are interested in the more like nitty gritty technical sides, like some of the bloody, parts of surgery, and the uncensored footage from our showcases, we have a lot more that we're putting out, and we're doing the uncensored on Patreon. So feel free to check us out there. We're going to do live streams probably starting in March of next year of certain surgeries that we do.
Sorry, this is a medium.
She decided to choke me.
We both have mediums on, right?
Mediums? Yeah, these are mediums. So yeah, and then also please, we need a way, Marco, where should we have people send us feedback for like this design, and if they want to see other designs, like, we need to know what you guys want. But also we'll slowly put out other things, again following along the lines of like the body positivity mantra. And I even thought maybe it'd be cool to have like little jewelry pieces of like lips and like a hair follicle. Like, wouldn't that be kind of neat? Little kind of pendants like that. So I don't know. I mean, this whole merch thing is something new, and but my mind is spinning. Like the creative wheels are turning, and we're gonna have fun with it. And if we can support some good causes along the way, that's great. One of the nonprofits that I really want to support is the Dachshund Rescue of Bucks County. That's where we had adopted our dachshund like 6 years ago. So we wanted to raise money for them, but they weren't in the YouTube system for as like a fundraiser. So we're working on getting them placed into it, and then the next live, hopefully, we'll donate to them, and I'll match whatever we raise. I'll match it because they really deserve it. It's a very small outfit in
Right. Like
local in Philadelphia, and they do great work. And we'll share more about our story with them.
And who doesn't love wiener dogs?
Yeah, wiener dogs. Yeah, we
on,
should
guys.
probably have a wiener dog little. thing.
Next time I'll wear my wiener dog hoodie.
Yeah, we have wiener dog hoodies here too. So yeah, so again, thank you guys for all the support. It's really fun to get on here and see familiar names and little faces, even though the faces are really small. But some of you guys I recognize from previous chats and from all your comments on our videos. And we've Marco had finals, so, and I've just had a lot of clinical work, so we've been slacking with a little bit of our video production, but we have no shortage of ideas. It's about kind of having the time and getting it done and getting it out there for you guys. But we have a few videos already in store coming out soon, and then a bunch more that we're filming. We're trying to get a Matthew McConaughey hair one done. I'm gonna tackle Ariana Grande's facial work soon as well. So but we put a lot of effort into them, so they're not like and I have a lot of clinical work, as you guys know. So we don't always have time to stay ahead of it, but we're gonna keep doing our best with that. But yeah, any videos you guys want to see, I guess in our community, we'll probably in the community chat we'll post with like feedback for the hoodies, any other ideas you guys have for videos. But again, we have such a long list of like really cool, like fun ideas for videos. It's just a matter of having the time to put them together. And what we've realized is that the celebrity videos do great, and as much as it's not my favorite type of video to do, I've accepted that it's it's what works, it's what sells, it's what people want to know about. So if I can infuse those videos with really sound medical information and never shame the person, because that's not my nature, but really just use them as an example to promote better awareness of procedures of the type that I do in my practice and that I know a lot about. We're going to continue to do that, and we're going to do that in addition to all these other educational videos that we have planned as well. So that about sums it up. I have 2 lip lifts tomorrow and a whole bunch of other things on my birthday. So I'm going to go rest. And Jay-Z hair loss video. He wraps it up putting his wig back. Yeah, that's funny. Yeah, maybe we'll do that.
Yeah.
So thank you. Thanks everyone. Happy holidays, Merry Christmas, Happy New Year to everybody. This might be the last live before the new year. But maybe we'll see. I say that now, but then we'll be like, oh, let's do a live. So again, great to chat with you guys. Have a good night, and thank you so much for the continued support. Thank you.